is the end of the morning ward round, and your last patient is reported by the nursing staff to be having difficulty swallowing. Your consultant tells you to pass a nasogastric (NG) tube as he is late for his morning clinic. You have seen one being done before, but you have never performed the procedure yourself. The nurses are not qualified to perform this clinical procedure. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Bleep your senior house officer, SHO, so that they can come and supervise you while you pass the NG tube. B. Inform your consultant that you are happy to pass the NG tube, but need supervision as you have never done it before on a patient. C. Ring up your registrar who is on the next ward and ask them to come and pass the NG tube. D. Take a nurse with you, pass the NG tube yourself, and get a chest x-ray to confirm the position. E. Wait until lunchtime when your consultant's clinic is finished and ask him to come up and pass the NG tube. Answer: B, A, C, D. Gaining competence in clinical skills through direct observation of practical skills, DOPS, is an important part of the foundation curriculum and is necessary in order to progress through your medical career. This question highlights the balance that is required between facilitating new learning opportunities and maintaining patient safety. Your initial response in this situation should be option B, as this ensures both of these aspects and also courteously informs your senior that you are unhappy to work beyond the limits of your competence. The person observing needs to be trained in this skill, however, and it may be a more junior member of the team that is most suitable. Conversely, passing the NG tube without appropriate supervision, D, would be negligent, even if you do use a chaperone and check the position of the tube with a chest x-ray. Asking your SJO to supervise and using this situation as a learning experience is the second best option. This is more proactive than asking your registrar to pass the NG tube, C, as you are capable of doing it but simply need to exercise the correct precautions. Following efficiency savings in your hospital, you have noticed that the workload of the elective surgical ward upon which you work has reduced. You're finding that you have finished most of the jobs by midday and are getting bored in the afternoons. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Contact your clinical supervisor about your situation and ask for their advice. B. Contact your consultant to ask whether you could conduct an audit for the department. C. Go and find your friend, another FI1 in the hospital, and help out with their jobs. D. Go to the doctor's mess and watch the news. E. Tell your team you're going to the theaters to see if any of the surgeons operating will let you assist them. Answer: B, A, E, C, D. This question assesses your ability to facilitate your own learning and commitment to professionalism while improving care for patients. Conducting an audit, B, is a proactive way of trying to improve the quality of service provision in your department and is an important activity that should be completed within your foundation years. Contacting your clinical supervisor is also sensible and perhaps more appropriate than options E and C, as by doing this you would still be working to benefit your team. They may also have good suggestions of how you can use your time to fulfill your training needs. Assisting in theater can be a useful learning opportunity, E, but it would result in neglecting your commitment to the team in which you have been assigned. It is slightly more preferable to option C, however, in which you have not informed your team of your actions. Option D is inappropriate when there are many other opportunities for you to develop your learning and contribute to improving patient care. Watching the news is a worthwhile activity, but should be kept for leisure time.